Okay, so we're live. Hello, Dr. Adi Choresh. How are you?
I'm good, thank you. How are you?
I'm good. And thank you very much for, taking from your very limited vacation time to talk to us. And I know that there are a lot of people who are really looking forward to hearing what you've been through in the last 11 months, almost a year now. But I'll start with just a couple of introductions or announcements that my name is Yair, and this is basically a webinar that is sponsored by Hope for Israel Alliance and also the American Jewish Medical Association. And just before I tell you about these two organizations, and very briefly, there will be a couple more webinars, and I'm going to post it in the chat for those who are interested. One of them is going to be actually today in 3 hours, and that's going to be hosted by a friend, Yotam, and it's going to be an interview with Professor Giora, who is, world-renowned in terms of researching bystanders and enablers in politics and the Holocaust. And I think it's going to be a really interesting conversation. And, it's going to talk about the passivity of many people, Jewish people, and also non-Jewish, are friends in the last year or so. So I think it's going to be a really exciting and interesting conversation. Also, just to let you know, in a few days, on Wednesday evening, we're going to have a conversation with JLV, the leadership, including the founder and CEO of the organization that has really been, taking the lead on fighting anti-Semitism in K to 12. So very relevant to those of you in the United States who are, have kids in K to 12. So that's that. Just to tell you a couple words about Hope for Israel Alliance, it's just an organization with people, Israeli Jews from all over the world, literally all over the world, Europe, many countries, United States, Canada, Australia, etc. And I think that what we're doing in this organization is really supporting Israel in any way that we can and fighting anti-Semitism. These are the main goals of the organization. The American Jewish Medical Association is an organization that was founded by Yael Halas about almost a year ago, and has really, gained a lot of traction, uniting all, not only physicians, but just healthcare providers across the United States who basically are fighting anti-Semitism, institutional, personal. And in fact, next week, she will be co-moderating a session with me, and we're going to talk about anti-Semitism in healthcare. We're going to interview the leadership, including CEO and founder of Do No Harm in Medicine. So that's next Wednesday. So these are a little bit of introduction, and now I wanted to jump straight into this. And we were very lucky to have Adi Choresh, and I'll just tell you about Adi, and then she's going to talk about herself. But she is a student. She was a student in Sameret, which is when I met her, or she was actually an intern. Sameret is a program in Israel for basically medical students. Instead of doing the army first and going to the IDF afterwards, kind of like what I did, you basically go straight after, when you're 18 years old, you go straight to medical school. And part of the training of the 6-7 years of medical school is also to become an IDF trained military physician. And I work at Jefferson in Philadelphia, and I direct or co-direct the Jefferson Israel Center. And in the last few years, we have been working closely with the Hebrew University on bringing many of these students, dozens by now, students and interns who belong to this Sameret program, to rotate with us. And that's how I met Adi a few years ago. And she's an incredible person. I actually heard a lot about her even before she came here. She's kind of famous in her medical school. She's brilliant. She's an amazing physician. And now in the last year, all that she's been doing is pretty much when she enrolled into the job of being an IDF physician, combat physician, that's pretty much when the war broke. So in the last year, she's been in Gaza pretty much all the time. And just to give you a sense of how, involved she is and sucked into the reality of Gaza, Adi got married about 6 months ago or so. And her husband is also an IDF combat physician. And listen to this. In the last 6 months or so, since the wedding, they have seen each other a total about 72 hours. Again, she got married. You know, we usually get married. A friend of mine who was just in the honeymoon, in the last 6 months since she got married, she saw him for less than 3 days. And that's her reality. So I wanted to tell you that Adi has been pretty much nonstop in Gaza. And just a few days ago, her parents are now in Singapore. She went to visit them, and she's now on her first vacation since all this craziness started. And she's going back to Gaza in a few days' time. So I think, Adi, my first question to you is, I have a million questions, but how are you doing? And how is the transition from you from everything that you have been seeing in the last 11 months to suddenly being on the beach with a cocktail?
So thank you for introducing me. Hi, everybody. My name is Adi, and it's really nice to be here in this webinar. As for your question, it was a pretty rapid change in scenery. I'm not gonna lie. I think it took me 3 days from the moment my vacation was approved. Basically, my entire battalion went on vacation for a week for the first time since the war started, and I was given permission to visit my family. I'm considered a lone soldier. It's like a title that you get if your family lives abroad. And within 72 hours, I moved from Khan Yunis, which is one of the southern cities of Gaza, to Singapore. And it was a pretty drastic change, but it was good to be home, good to be with my family. Um, we always switch in and out of Gaza. It used to not be very often. We used to go in for a very long time each time. And in the past few months, it's been a little less crowded. We would go in for 3 weeks and then leave and stay in Israel for a little longer than what we were used to. So we usually would take the time for the soldiers to rejuvenate a little bit at base before going back home to their parties, to their friends. Um, so this time it was pretty drastic, but I'm not going to complain.
You are, a really resilient person, and I want to hear. We're going to hear a lot about your experiences in the last 11 months or so. But maybe you can tell us a little bit, just for background about yourself. How come your parents are now in Singapore, but you did your medical school in the Hebrew University, and how did you get to the army? Maybe just a couple of words for background before we jump
Yeah.
straight into Gaza.
Okay. So I grew up in Israel and in Singapore. Uh, my father used to work here in the area when I was younger, and I did high school in Israel. And during high school, I realized that I wanted to be a doctor. And I think I was very adamant, I knew I wanted to be a doctor. And I also knew I wanted to be an officer because my father was an officer in the army, and my family was very, did very nice things in the army. My sister also wanted to be an officer, and I have a twin. And we both did our programs of academic reserve. She went to study engineering, and I went to medical school through the army. When I was in grade 11, there was a big operation in Gaza in 2014 called Protective Edge. And it was the first time that women participated in battle for real. And I saw women who were back then my idols, and now they're my colleagues, who were saving lives under fire. And I kind of just had an epiphany. I knew that was what I wanted to do. Um, so I took the test and I did, what you have to do to get in. And I started medical school when I was 18. Did the 6 years of training in the Tzemeret program, which is the equivalent of there's the same program almost in every big military in the States and Germany. You study with a group of another around 70 students, as well as the regular students. And you have extracurricular military related programs that you go through, parallel to school. So you study a little bit about the military, about military medicine, and you do basic training and an officer's course, and you have this whole long marathon, at the end of which you return to the army. And I returned to my service, my actual 5-year obligation at the end of medical school. That was in August of last year, 2023. And usually, what we do is a 5-month long course to get used to the army and to learn how to be a physician in a battalion. It's pretty different than hospital medicine. You have to be a commander, you have to be a physician that does other things than just regular medicine. So that would have been nice to do, but it, I think the war started a month and a half after I drafted, and there wasn't really that much time to study. They needed doctors, and those who were fit to go, we had some experience watching our friends. And first, I was taken to the headquarters of Division 36, which normally is in the north. Right now, they're in the north. And I learned there what the war looked like and how we evacuate patients and how we talk to the helicopters or to the Air Force and how the decision making happens. And after a month there, I started my service in Gaza last November. I joined Golani at first, the Golani Brigade. I was in Battalion 51, which was a battalion that was hit pretty hard. They were in the Otef, in the kibbutz next to Gaza called Kisufim on October 7th. And they had 32 casualties at the point where I got there. And it was a very, very tough place to be because the soldiers they lost their friends, and it was very emotional, and I learned a lot there. And after 2 months of being there as just a regular doctor, I started my role as the doctor of Rotem. Rotem is the battalion in Givati, the Givati Brigade. It's part of the Southern Corps, and it's one of the brigades that's been active in this current war since the first second and nonstop. And I'm very proud to be their doctor, and I think my unit does a great job, both in operating and fighting, and both in treating and allowing me to do my job and caring for patients, caring for wounded soldiers. And so that's what my last year has been, and it's been kind of crazy, but I think it's like our calling now. So it's a big opportunity.
So the first couple of months when you're with Golani, it was more it was not as in the most action difficult war zone. And later
No, it was.
it was
It
also.
was. I wasn't the only person in charge. I wasn't the commander of what's called a Tagad. It's like the Department of Medicine in the battalion. So as the doctor of the battalion, you're also their commander, and you're in charge of all the medicine and all the evacuation. And when I was in Golani, there was a doctor that was his job, and I was learning from him, but I was also there as a physician because you always have a few. So I saw the way he operated, and I helped him, and we were in my first day in Golani was, hi, this is the vehicle that the armored vehicle. We have those big vehicles. They showed it to me at 10 p.m. and we crossed the border at 11 p.m. That was my first day. And then we stayed in Sajaiya, which is in the north of Gaza, for 3 weeks. And we did another 3 days at home. And we went back to the camps in the center of Gaza. That's how I started. Usually not the kind of start people get to their job, but that's what we needed to do back then. That's how the war started.
So you were thrown right into, in the first few weeks, you were basically working as a physician, dealing with crazy stuff, but side by side, but another physician, IDF combat physician, who you kind of like you shadowed as you were doing stuff. And then a couple months later, when you went into Givati, that's it. Now you're it.
Yeah. So when I was in Golani, I learned a lot from that other doctor. He's a year older than me. We went to medical school together. He was a year ahead of me the whole time. And when I started in Givati, um, I was the commander of 11 new soldiers that I had, to boss around and tell them what to do, but I was also new. And I had to be a reassuring factor to everyone, even though I didn't really know anybody. And on my second day, the first time I met the commander of the battalion was when we were waiting for the helicopter because we had wounded soldiers. We had a grenade thrown into one of the buildings that we were at, and a head of one of the companies was injured with his soldiers that walk with him usually. And that was the first time I met everybody. Up until then, I was just in my own little trying to figure out who's what and what's where. And you don't really have a lot of time to adjust. You have to be a rapid learner. Um, and you're thrown into a lot of situations. But I think that, first of all, I think some people had it harder during the war. And also, if you don't learn fast, then nobody's going to wait for you.
Wow. So can you tell us, like in the last few months when you're in Givati, maybe a little bit about, because some of us on this group of people, attendees, have been to the IDF, served, but I don't think that any of us, or I have not been in any situation like yours. Can you tell us a little bit about how, like a day to day, you wake up, what do you do? Do you have other physicians? I mean, how does a day, you get ready, quickly eat breakfast, and then just go to the field? Or are you always like every minute can be, you can wake up with like, okay, running and saving somebody or triaging? How does your day look?
So we're always on call. You always have to be ready. Um, but you can also uh, quiet down a little bit because it depends on what the rest of the battalion is doing or what the rest of the brigade is doing. But as a doctor and as a person in the battlefield, you always have to expect the unexpected. That's like what they usually say about war. It's everything is unexpected. So even if you think, okay, now is a good time to go to bed or to take off my shoes, and then the next minute everything just goes to it can explode or can, things just happen. But mostly what happens is that we would wake up in the morning and then we would see what the plan for that day is. We would have some time before that we would patrol or, just other people would do it. And then we would have to be extra on call, to be ready if something happened. And then we would have, the operation for the day and, missions that we would have to go on. And basically, we have a few units. So each battalion has a few companies, and each company has a doctor or a paramedic. And I'm not in the companies, I'm in the unit that's in charge of evacuation. We're all in the same place, but there's an there's independence of treatment for each company. So if there's something that happens, there's a doctor or paramedic on the spot that can tend to the person, and then we come to they let us know, and then we come and we do a transition of the patient. We transfer them to me, and then I take care of them and I evacuate them to the helicopter or to whatever we do, depending on what they have and what needs to be done to them and how fast they need to be evacuated. So basically, at a given time, we would be around 5 to 6 physicians or paramedics to a battalion, which is a lot. A lot of medics as well. Each doctor or paramedic has at least 2 medics with them, and they're all very talented and all very well experienced at this point. Um, and that's it. And sometimes, we have whole days that we don't do anything. We just wait and we accompany the forces. And other days can be crazy. It depends on where we are and what we're doing, and sometimes just bad luck.
Adi, I'm gonna incorporate. There's already quite a few comments and questions, and I'm gonna start incorporating them soon. One of them, the first one, was actually about evacuation, which is obviously kind of one of your specialties. But before that, I wanted to ask you something. And you and I have talked this preparation for this meeting several times, and the stories that you told me. I mean, the hell that you're seeing, the death, including people dying in your own arms, and injuries and crazy things. It's unbelievable. Like, I have never seen anything even close to this. And this has been your reality nonstop for almost the last year. And yet, when we talk on the phone or, in a Zoom conversation, you're so like resilient and strong, and, like, you're basically talking about it very professionally, and somehow you're protecting yourself. What are some of the things that are helping you get through this and still be completely normal despite all the hell that you're seeing?
So I think every time people ask me this question, the first thing that comes to mind is that so I'm not only a doctor, I'm a commander, and I have my 11 medics and paramedics under me. They're my soldiers. I'm in charge of them when we're at war or when we're at base, and I love them. They're like my siblings or my children sometimes. We don't have that big of an age difference. It's like 7 years. Um, but I'm extremely proud of them, and I need them to be proud of me, and we need to be able to work together. And my purpose of being in Gaza is very easy to fathom. I don't need. Sometimes the soldiers are like, "What the hell are we doing?" Like, we don't understand the mission, and sometimes the commanders need to explain because we don't always tell all the soldiers everything. But for me, it's easy. And for them, it's easy. As long as there are soldiers in Gaza, we have to be there to take care of them in case something happens. So that gives you a lot of power to continue and gives you a lot of strength. And I really believe that that's the main thing that keeps me sane. But also I have a lot of colleagues, the many doctors that come, they're reservists that they join. They sometimes have kids, or they're senior doctors in hospitals in Israel, and they find it important and to come and to help. So it's always nice to have your colleagues around. And my husband and all of my close circle of friends, they studied with me in Summit. And most of us are in the front lines. Um, Sometimes when I'm in Gaza, I get to meet my friends because our battalions are close to each other. And then we would be able to meet and talk. And we usually have the same experience and we feel the same things because, we're similar people. Um, but yeah, I think it's a very big challenge on one hand, but on the other hand, you know, there are things that I mean, I see it's not very hard to remember why you're there when you're there, even though it's hard. And for me, I have the responsibility to remind and keep other people going. And I think if I break or if it's too hard for me, then, it's just the price of that is going to be very big. So that can't happen.
Wow. So, just as a reminder, because more questions are piling up, these sessions that we have are always 60 minutes with a hard stop at 75 minutes. Honestly, it was always scheduled for 1 hour, but it always goes above. But, it's 10 p.m. at your time, and I don't want it to be until, we'll stop exactly at 11:15 p.m. your time. So, but I will start asking questions from the attendees. So the first couple of questions, I'm going to lump them together, is I know that a lot of changes have been implemented since the war, like the highest commanders of the IDF medicine, is what is the process like of evacuation? Let's say that a person is hit and significantly injured, and the paramedic or somebody is the first response, and then you come, and then maybe 669 or the helicopters come. How long it is until they are So several questions about the process. How does it work? What is your role versus the 669 or other companies, physicians? How do you work together? How long does it take from the moment of injury, do you think, or first response until the person is actually in the OR at Soroka or whatever other hospital?
So I think the IDF can righteously take pride in their timing of evacuation in this war, even though Gaza is pretty small. Um, Still, we have very good averages. I think for the entire Israeli military, the average is 1 hour and 6 minutes from injury to the OR. And in Givati, my brigade, we take pride in that it's only, I think, 54 or 56 minutes. I think the key is two things. One of them is that we have very good independence of each battalion, which means that if, for example, there are two events that are going on in two different areas, each unit has the independence to tend to the wounded soldiers and then evacuate them without involving or requiring assistance from any other body. That's one thing. And the other thing is that we have very good communication between us inside the battalion, from the battalion to the brigade, from the brigade to the Air Force, or anybody that has to go to, to come in between all this chain of people. And basically what happens is that when we hear in the communication system that there's been an event that's, an explosion or a shooting or, anything that causes casualties, we very, very quickly get there. Sometimes we're already in our vessel most time, but other times we would just be anywhere. But we're always listening and always alert. So we get there very fast, sometimes faster than the caregiver of that own company. And we get there and we evacuate the patient to one of the to the helicopter pads that we have in Gaza, and or outside the border. It depends on where you are and what the operational state is that allows you to do. And basically a big part of what we learned in the war was what to do, what not to do to a patient, how to resuscitate, what to try to avoid, what has a higher success rate. That's one thing. We have whole blood in in the level of the battalion, which is something that doesn't exist anywhere else. We had a few months ago, there was a group of senior doctors from the American Army and from the Navy and from the big military hospitals in the States. And they came and they sat in my armored vehicle and they looked at my little fridge with blood and they were amazed. And it's funny, but we're doing very, I think, very forward things that are, I don't think they should be taken for granted, and a lot can be learned from the rapid learning that we're doing. So basically, usually, I think most patients that we see are severe enough to be evacuated with a helicopter. And you were asking about 669, they're people, they're on the helicopter. So when I finish treating my patient and I'm waiting for the helicopter to land, I would go on in the communication system and I would talk to the physician on the plane and tell them what he needed to prepare, what the vitals of the patients are, what they need to know in general, what happened. And then we do a very rapid transfer of the patient. We try to do minimal transfers. So for me to the plane, and then they rush them to whatever hospitals decided.
So they're going into more into the injuries and the things that you've seen. There have been a couple of questions about examples of things that you do, like the injuries that you treat, and not only the injuries, but I remember that you told me a few days ago when we spoke about the, to show an example that showed that you're not just a physician, but you're actually a commander, and your input is important also in terms of the battlefield and decisions that are made. remember you told me about the soldier or the commander
Yeah,
that had a, maybe you can explain a little bit more about what happened, if you can, and tell us also what went through your head when you had to make these super difficult decisions.
sure. So, uh, as you can imagine, we treat our friends most of the time. So we usually know the people who come in, or we arrive, and sometimes you can recognize the person, sometimes you can't, depends on the injury. But I was talking to Yaya the other day, and I gave him the example of sometimes you don't really have a question. The injury is severe enough or not severe enough, so if you need a very rapid evacuation, or if you can keep the patient there and maybe evacuate them later, or not even at all, just treat them on the spot, or if it's not that urgent. But sometimes the situation of the battle necessitates decision making that's not the easiest to make because, for example, I had one of the commanders in my battalion. We were in the rescue mission, the one in May or June when we rescued 4 hostages from Nuseirat. And my battalion was in the midst of this whole thing. And basically, any evacuation that we would do during the operation could terminate the operation. And one of the high ranked commanders had shards of, I think, a grenade that was thrown at us or an RPG that was shot. He had shards all around the one side of his face and around his eyes. And they basically had me arrive to where he was. We were kind of driving behind them, and you drive with your head outside. So that's how he got injured. And I had to reach him, tend to him, and then see if he needed to be evacuated immediately. And this type of injury would usually require immediate evacuation. But I knew that if I took this guy out and I took myself with my evacuation unit out, then I would be causing harm to this operation. And sometimes these decisions of minutes, of seconds, or anything like that can change the whole operation. And I chose to try to calm him down, try to cover part of his eye. I cleaned out his wounds. I spoke with him. I saw what kind of stress level there was there, and I tried to assess how long more he could be okay without any treatment. Still close enough to me that if there was any deterioration, I would be able to reassess later. And I made a pretty risky decision, but I thought that was the right thing with the information that I had at the moment to allow him to continue. And I wasn't 100% sure. I could never be. I don't have a CT scan. I don't have anything. I don't know how deep the shards are. But that's the decision I made. And at the end, we were successful in rescuing the hostages, and we returned to the base. Not even stayed in Gaza early later that day, and I was able to send the guy to the hospital, and I was able to remove some of the shards myself in my clinic. And that's an example of an injury that turned out not to be too severe, but had, a major dilemma around it because I knew that if I chose to evacuate him, we may not succeed in our mission.
I can't imagine. I mean, I'm a little bit older or a lot older than you, but to make such a decision, I always remember myself, you're probably around 25 or so. And, you didn't finish medical school that long ago. And to make such decisions on the battlefield that have implications of either maybe saving the hostages if you allow the operation to proceed versus to abort the operation potentially because that person may die. It's kind of like, I don't know. I don't have words. It's so, it's like the how precious the life is of that one officer, that one commander versus a mission and potentially the lives of others, it's a impossible reality.
Yeah, it's that. And you also, sometimes we're doctors. Most of the time, nobody argues with you. When things are calm, nobody, says anything about your decisions. But if you have to explain to your commanders why you're halting the operation and why something that may look very, normal to them, you think is life risking, then you have to be very persuasive and also very strict, and once you made a decision, you don't go back. So the thinking has to be fast and you have to be confident enough. And I think with experience, it becomes easier. When I started my job in November, I was very precautious. I was very conservative. I didn't want to risk anything at all. And I said, okay, the soldiers life and organs or before anything else, and I still think that, but I understand that sometimes not risking that person's life in this moment could cause or risk other people's lives because of the decision I made. If I chose to land a helicopter here and now, and they would listen to me, if I gave my reasons, they would listen to me and they would do it. I would be risking other people. And if I halted the operation, then these people may not have been home. So they're it's a lot on your shoulders, but you also get to learn from other people who are experienced, and you have people around you validate your thoughts. So it makes it a little bit easier.
We may, if we have time later on, we'll hear more such, stories of amazing rescue and, the things that you have done, and you kind of became famous in Israel. But I want to ask you another question, and this is based on a lot of questions from the audience, actually. In the United States, where I live, there's a lot of people who are fighting anti-Semitism. There's a lot of anti-Semitism. I'm in healthcare, and I have seen many people, both in person, in meetings, people who are basically accusing the IDF of being a vicious organization that basically comes and what they want is to cause as much harm to the local population. I participated in a meeting, may have been the most difficult meeting I've ever, some of you here know about this, in Philadelphia, where a physician who is, very much pro-Palestinian and has been to Gaza several times, and he volunteered as a physician in Gaza just a few months ago. And he came back and he made the worst accusations. For example, he wrote in the LA Times an op-ed article that basically caused, something, the title was something in the way of what is happening in Gaza. That was the title. Is not war, what is happening in Gaza. It is annihilation. And in the meeting that he described what has happened, he's basically saying that IDF snipers are shooting purposefully children who are 5 years old, 10 years old, on purpose to kill and to cause much damage, including to children. Awful stories. A lot of what is happening now in anti-Semitism around the world is basically accusing the IDF of annihilation, of massacres, of genocide, of all of these things. And in this setting, the next question to you is, you speak Arabic. That's one of your many, many talents. You're able to communicate directly with the local population. Can you explain to us, have you been involved with treating local Gazan people, children, adults, and what is your impression about, your honest impression? You're an honest person. You're going to tell me exactly how you feel, but what is your impressions about what I just said? The IDF being a non-moral organization, and how do you see things, and what is your experience in the last year? I know it's a charged question.
Yeah, so I think it's a painful topic, even for me personally, because of my history that I grew up abroad, and I always felt like I was kind of an ambassador to Israel, and I take a lot of pride in being a doctor in the IDF. I think that we're a very humane army, and in the impossible human situation that we're in, I think we do a very good job at protecting civilian lives and protecting children. And I can say, you can see the data, about the population size and about, I don't know, anything else you can see on the internet. But I think in my personal experience, what's been staggering for me, I don't know how people imagine the battlefield or a war in general. We don't really see a lot of population because mostly where the IDF goes, we usually, give out flyers beforehand and we warn the people that we would be operating in a certain area. And most of the time when we're there, there's not people. You would see Hamas terrorists with their guns and their clothes, and they look like soldiers, and that's who we fight. But in the very few incidents that we did encounter population, I think those encounters were, for me, they were complex, but they were pretty positive to the Gazan civilians who met us, who spoke with us, who were attended to by me personally. My first evening when I started in Givati was a night in the end of January, and we started an attack that we told the population that we were coming, and it was my first night. I arrived at 11 p.m. and 3 hours later I was woken by one of the commanders in our battalion who told me that one of the terrorists that stayed in their own house kept his own family in the house. So there was the guy, his wife, and his two children who were around the age of two and a baby, a very, very small baby. And they were in the home where they weren't supposed to be. And that home actually had a tunnel inside. And it was not a civilian place, I think, to anybody who has ever pictured what a war zone would look like. But the guy chose to keep his family there, and we arrived, and our forces, I don't I think they threw a grenade inside, and then the family came out wounded. And it was my first night there, and we knew that we would not have any supplies of water or food or medical equipment for the following week. And I knew that I would have to be very protective of the scarce equipment that I had when treating soldiers. And then I get to my hands a family of a mother that had burns around her arms and a baby that had some burns around his scalp. And the kid and the dad had a broken leg. And I treated them and I spoke to them in Arabic and I calmed them down and I gave them pain medication and I held their baby and kept the 4-year-old child from crying, and I explained to her and she wanted to stay in my arms, and I'm an Israeli soldier wearing a helmet and a vest. And I think it was one of the most difficult situations I had ever experienced. But this family, I don't think will, in years when this little girl grows up, I don't think she's going to have a lot to say against the Israeli army. And she knew I was a doctor and I was tending to her dad, and, she was there and she was not calm at all, and the wife wasn't, but they understood that we didn't attack them on purpose. We had no intention of keeping them at where we were operating, and we did a lot to get them to a safe zone. And I can say that even my husband, when he even when we had Hamas terrorists that we were taking to Israel for interrogation, he would tend to them and give them very precious equipment or medical aid that we give soldiers. Once you treat somebody, you treat them regardless of what they are. And when I was telling this, even to people in Israel, they understood. They had, they asked me like, why would you, take care of them when they treat our hostages the way they do, and then went down to 36 kilos. And I understand the dilemma, even though I'm a doctor and I took an oath. I understand the dilemma. I'm not, I'm not going to pretend that I think it's easy and okay, but I think what separates us from them is is this. And amidst all the anti-Semitism, I know in my heart that I'm there and I see it. And I've been an Israeli my whole life. I don't understand the claims. And I don't think I'm just, a person who reads the news. I am the news. So we don't have snipers looking for children. We barely see children. I mean, they're literally not there. And when they are, they're treated as kids who shouldn't be there. And it's not just me. It's not like because I'm a doctor. It's everybody. That's the education my soldiers have from home, regardless of their political opinions. And that's the expectation I have of my soldiers, and they know it. So when that's our moral standard and the complete opposite is shown in the media, then it's stressful and it's disappointing and it should be, abolished. We need to be better at explaining what we do and what our goals are. And I don't think we're nowhere near where we should be because people know very well lies or inflation of numbers about Gazan casualties, but they don't know to tell you where we have hostages, how many there are, what happens to them, why we're even talking about it. So as I said in the beginning, it's a very painful subject for me.
I think I'm gonna ask another question about this. I mean, I can only imagine how, like, your first night in the new job at Givati, that this is like you're treating a family and a child and a mother, and you know that their family members are kind of force them to stay there while there's a tunnel underneath that, who knows, maybe leads to the hostages. I think I can see how you're treating equally every civilian like that mother and her child, but you or your husband, when you're treating, let's say that there is an encounter and there is a Hamas person, a Hamas terrorist that has been injured, and you or your husband have been walking to and trying to start thinking, okay, should I treat him? And in my head, these are the people who broke the border on October 7th, who went and raped and murdered and kidnapped and tortured. And they look into your eyes when you're the treating physician, and you know that they have so much hatred, and if they could, they would kill you right now. I mean, it's hard for me to grasp how does that translate into the fact that, okay, you have a IDF soldier that was maybe wounded, not so severely, and then you have the Hamas terrorist who's injured more severely, and you will attend and completely isolate who he is, what he is, and be able to effectively, professional, provide him the best care?
I'm a doctor. I'm not a judge, and I'm not a politician. And in the impossible setting of war, I also don't make a full sterile decision on my own. Sometimes there would be someone who I wouldn't have access to. But if I did, and my commander is there, and he would tell me to treat the person, and I have numerous times treated Hamas terrorists for the sake of transferring them to Israel to be interrogated or to be placed in prison. And so I think their incarceration or any other punishment that they would get, they would definitely deserve. But for me, as a doctor and as just me with my morals and the morals of the army that I serve in, and I'm proud to, that's how we work. And there could be a lot of scrutiny against that, and I understand it, given what happened to us. But I also have to say, like I said, that's just what separates us from them. And I would rather be on that side of history.
Very powerful. I am going to combine a couple of questions from Naama, who's a close friend of mine from the community here of activists in Philadelphia, and Gail as well. And this is more about the feelings or emotions or behaviors and of the soldiers who are in Gaza for almost a year nonstop, and and how are you how are you dealing with the mental stress and the heaviness of the situation and the horrors of this, day in, day out. I mean, I think that it's you told me that the IDF has been very effective. Maybe you can tell us a little bit about what they have been doing in terms of the transition. They don't just take people who were literally in active combat one-on-one and send them for a vacation. There's like a process that they're trying to really care for. And again, just to emphasize how hard this is, remember that when Adi and other soldiers are in Gaza, even though Adi is, a senior physician and she's a commander, she's in Gaza all the time. She has no communication with outward. She doesn't have the possibility to, whenever she wants, before she goes to sleep, on WhatsApp to text her husband, and he's also in combat. I mean, think about it. I mean, it's still, it's still in my head that they got married 6 months ago and they saw each other for less than 72 hours. And that's just an example of the reality of so many soldiers and commanders on the ground in the IDF in the last year or so. So if you have any comments about how you're taking care of yourself, how are soldiers taking care of themselves, mental health, stress, and how the IDF is helping with all of that.
Yeah, so I think uh personally for me it's pretty different. I mean, I'm a little older adult and I'm a doctor, and I think for me the dealing with this whole thing would be a little different, but for the average soldier, uh, there are mental health issues. They feel a lot of time, when you kind of zoom out, they understand that they're experiencing a reality that's not normal. It's not normal for a 19 or 20-year-old child, and I think child, but it's not normal for, even for an Israeli soldier 2 years ago. Who would have thought that a combat soldier would be physically in combat for so long? And the emotional toll on them and on their families is huge. On the other hand, I think that, while these are the Gen Z TikTok kids, and, when they talk to one another, you're like, oh my God, they're 19-year-old boys. When they're fighting and when they do their military job, they're so adult and so grown up and so serious and so dedicated. And they have a lot of mutual respect and care for each other. And I think that's one thing that keeps everybody going. They understand that if, we have a certain amount of food, then it's to share. And if you have a certain amount of anything, you share it with your friends and you take care of each other. I think that's something that's been very well implemented just in the IDF norms, and it's been, taken to an extent that's um, a little, more extreme in the war. And on the professional side of things, when we leave Gaza, it used to be that, you leave and then you sleep at base and then you kind of immediately go home. And at some point, the army well realized that it's not the best thing, and that soldiers need to have their safe place at base, and they need to be able to talk and kind of go over what they went through and to take care of their equipment and to to kind of set things back to a certain balance point. And after they do that, then they go home. And I think it's a good transition that's less rapid and less just I think it's too much to just kind of go home and without anybody asking if you're okay. And we have in every brigade, there is a mental health officer. And it's a big name, but it's usually either a social worker or a psychologist or a psychotherapist. And these people, they, first of all, they scavenge. Okay, they look for where something happened, where there was a company with a wounded commander or a wounded soldier, or any, a platoon that lost someone. And they come and they introduce themselves and they talk, and you know, and they dig out the people who need care. And also for me as the doctor, then I also recommend or I scavenge myself. And if there are problems, then we introduce the this person, and she takes care of the situation, and then people can get treatment, not just at one time, but it's ongoing if it has to be. And also, every once in a while, we have workshops where the entire battalion, my battalion had it this week, 2 whole days. They took the entire battalion to a hotel in Jerusalem. Each platoon received, it's around 10 to 20 people, got one person who's an educated, usually it's either a social worker or a psychologist, and they sit with them and they talk and they go over the events of the war in chronological order, and then they talk about the things that were a little more extreme or more difficult, and then people share what helps them and what's more challenging, and they talk and they kind of normalize the whole situation. And then again, if something is requires extra care, then it gets the attention. And I think for the most part, the commanders, as opposed to what it was when there was shame in it, and then if somebody needed something, then they would hesitate. Today, it's a lot easier and it's a lot more accessible, and there's, everybody uses these mental health resources, and I think it's become normal and socially acceptable, and I think it's a very good thing.
And just to echo one of the comments of Gail, that she says that she's volunteered at Metiv Trauma Center and she's a therapist herself. And she has seen exactly what you're saying, that there's a lot of different programs to help the soldiers deal with all the stress and the emotional trauma and everything. And, I think it's so important. There's another question from the audience from Itai, but before I jump to that question, I just wanted to mention that one of the anonymous attendees was saying, thank you for discussing all of this, including how you have been treating the civilian Palestinians and what your thoughts are of how IDF are really, really doing everything that they can in order to avoid injuries of civilians and avoid casualties and really try to evacuate areas as possible. And really, if there are people who are injured, like the description that you gave of yourself running and helping and providing amazing life-saving treatment and evacuation of civilians, Palestinian, Gazan civilians, I think that it's so important. And what this anonymous person is saying is that, this should be like more. You have a very powerful voice. The way that you're describing things is amazing. Your English is amazing, obviously, but more people need to hear about this because there's so much noise and lies and horrible things that people, including physicians, are posting all the time or writing in op-eds. And we need to hear more from the IDF. So this actually is not a message to you. It's a message to your bosses in the IDF. We need to replicate stories like yourself. And, it's so clear that you're an honest person and you're just basically talking from your heart. I know you, but even people who just hear you, they know that you're talking from your heart. And I just agree with whoever wrote this comment that it's so important to get the story out. This is what IDF is about. It's about returning the kidnapped people, protecting Israel, but also protecting as much as possible the Palestinian Gaza civilians. I really think that it's important. So thank you for the person who brought it up. I want to move to the next question of Itai. What, in your opinion, Adi, is some of the most valuable tools that you have learned to use in the last year, or concepts even, either tools like the blood that you're talking about, or even concepts that make a meaningful difference in terms of how you care and how you save people every day?
So, thank you for your question. I think that the IDF Medical Corps has been very rapid and good in mutual learning from the very first casualties in the war, even in the OTEF, even before we started operating inside Gaza, but also during the operation itself and the war. We have several things. Before, we used to have protocols that um, included a lot of interventions. We would do chest tubes to less specific patients, and we would intervene with airway or intubation to patients who now we understand we don't need to, because we understood that rapid resuscitation, um, regardless of, not regardless, but we just try to get resuscitation as rapid as possible and stopping the bleeding with tourniquets or with certain gauzes that we have. And we have very good technologies around that. We give blood that we're able to cool and store inside fridges that are in the armored vehicles. These are things that are not very easy to do. And we get creative with a lot of things that have to do with how we store our equipment and what kind of equipment we have. For example, we have portable heating machines that we can connect the blood to, and then connect the machine to the patient, and then it heats the blood, so we avoid hypothermia, which is very dangerous for a patient in shock. And we also have the whole system of the evacuation itself. And I think these are things that basically were made more and more simple, but they require a lot of understanding of the mechanism of the injury and sometimes require experience. But in the end, they do a very, very major, they make a very big difference to the patient. How fast you get them to the hospital without wasting time on procedures that we don't really need, understanding that the mechanism of the injury has, implication on the way you would treat the patient, even though they're not showing you certain clinical signs that you would expect. You have to be very suspicious and look for those. And the whole construction of our team and our evacuation vehicles is also another story, because for me, I evacuate in my armored vehicle. It's called a Tiger. So it's this big machine that makes a crazy amount of noise. And when you're talking to your two medics that have to basically read your mind in order to understand and know what you need at that certain point, it takes a lot of practice. And inside this vehicle, you have very creative ways of placing the patient and, straining them to wherever you need in order for them not to fly everywhere when you're driving. But also you need to develop skills to try to, get an IV, get access while you drive and jump around everywhere. And it's not a very safe, soft ride. And for me, when I don't get good access fast enough, then I use IO access. And we're very,
For those who
I'm,
are not physicians, what is IO?
oh, so IO is, instead of doing an IV, which is opening one of the veins and then giving blood or any other medication through a vein, sometimes when people have very, very low blood pressure, you can insert a nail into the person's bone. Usually we do it either in the leg or here around the arm. And then we give blood supplies or anything else through that needle into the bone. And then from the bone, it reaches the blood circulation and enables the patient to be resuscitated rapidly without wasting time on, technical issues or technical difficulty or just inability to get the traditional IV access. And I think when we become, when we take care of these things fast enough, then we can get faster to talking to the patient, making sure they're okay, giving them pain medication that lowers the rates of PTSD. And the whole holistic treatment in the army is basically this. It's making sure the patient stops the bleeding, locating where the bleeding is before, and giving as much volume as you can. And there's a question of what kind of volume. We don't give we don't give normal saline, or we don't give Hartman or all these non-physiologic things that are not very good for trauma patients. So we have very specific things that we use. We learned that they're good. We're making them more and more available, made simpler to use in more situations, simpler to carry, simpler to store. And with this and the expertise of rapid evacuation, I think we've been saving more lives than we thought we would initially, and it's a big blessing.
Amazing. So we have about less than 10 minutes and maybe a couple more questions, but I didn't want to make one comment from a friend, a healthcare provider colleague here in the Philadelphia area, Beth, who is an amazing psychotherapist, and she just wanted to share with you and others that she's an American and she's a mother. Her son, one of her children, her son will be graduating combat training into Givati and Gaza on the beginning of November. And she says that it really calms her to hear you talk, that doctors like yourself who are so competent and caring and ethical will be there. So she really as a mental health professional, she really values all the things that you're discussing, including initiatives of the IDF to reduce PTSD down the road. So thank you, Beth, for this comment. I wanted to ask you, Adi, something. So what is your next, I think that you're not basically going to do your whole 2 or 3 or whatever next years in the same position. You're going to go back to Israel and Gaza right away in a few days from wherever you are in Thailand. How more do you have in this position in the brigade as an IDF commander and combat physician in the Givati brigade? And what's your next move or next position? Do you know, or how does it go? Or they're going to keep you there indefinitely because of the war situation?
So I think usually what we do is a year and a half long position in a battalion, which is being in the field and doing what I do. And as I said, like me, there are a lot of physicians, both male and female, who are doing the same thing. And for me, I just started. It's funny, but I just started. I'm only 10 months in, and I'm in my current job 8 months now. So I will probably be there until the next year for the following year. So it's gonna be pretty long. But after that, I would want to be either. I have options. It depends on what becomes available because you need to change other people. Um, but I would want to be the doctor of the Givati Brigade, which means that I would be the one managing like my he's not really my commander, he's like my he's in charge of me medically, but he's a good friend and a colleague. And basically what he does, being in the brigade, not in the battalion, he goes into Gaza sometimes and he's in charge of the evacuations. He's the one who calls the helicopters and he's the one who listens to us. And when we have more than one patient, which is most of the time, we have more than one wounded soldier, then he makes sure that the neighboring forces, they join us. And then we have more doctors and more blood and more vehicles to transfer these soldiers outside. And we have a lot of options. You can go into elite units, and you can go manage a clinic. You can be a commander of a clinic, which is basically like being I don't know, the equivalent of a head of a department in the hospital. So we have a lot of options, and we do 5 years overall, and people usually find their niche. I think for me, I think the dealing with the battle and trying to bring that to be more advanced forward, and taking care of these younger doctors who like me were thrown into the water very quickly. I think that's something that's very challenging on one hand but also very gratifying.
Dee, do you think that all this work in Gaza and all the craziness that you've been seeing, because you just finished medical school, you did your general internship, and in the future, in a few years, when you're done with the IDF, then you'll have to decide upon what specialty. Do you feel that this experiences are going to influence what you choose ultimately, internal medicine, surgery, trauma, ER?
So I always wanted to be a general surgeon. And even when I came to Philadelphia, I tried, I said maybe I'll be a cardiologist. I like the interventional areas in medicine. But I always thought it might be too hard or the pressure will be too much. And what if I freeze? And I had all these thoughts. And now they seem a little funny. It's like, okay, so what I do alone with two 20-year-old medics, in the hospital, it's like you have five nurses and three physicians with you. And that's where I thought I would have difficulty. And I think, each area is a little different, has its own challenges, but it's made me realize that what I thought was unachievable is maybe not easier, but more achievable than I thought. And on the other hand, sometimes I say that I might want to rest a little bit and I'll go to dermatology or something. Uh, but we'll see. Time will tell.
Well, if you're going to be a surgeon or a dermatologist, whatever, I have no doubt that you're going to be the best of the best. I want to ask one more question of Kim, who was also from the area here in Greater Philadelphia. And she was wondering, and I'm sure that a lot of people are wondering, because in the last year, there's been so many requests, donations, and maybe helmets, and maybe shachpats, a vest or whatever, ceramic vests. She's asking, and maybe you don't know, is there anything that we in the United States, Australia, Europe, all these people who are watching, that we can potentially send from wherever we are outside of Israel to show appreciation to you, to the IDF soldiers who are day in and day out in Gaza, maybe help with the needs, lift the spirits?
So thank you. I think the first and foremost thing that, I would want to tell you is for you, to realize that just the fact that you're there and you're combating the anti-Semitism that's targeted towards you, and that you're, putting a front and, just dealing with this thing and being our ambassadors out there, it's making a very big difference for us. And when we know that you're proud of what the soldiers are doing and that you believe in the right path that we're taking, and understanding that we're not seeking any harm to anybody, just trying to do good, and that itself, your support is a lot. And we try, I think we want to make the Jews and the diaspora proud and able to say that they're proud of us without, it being it feeling dishonest or something. I think you can be. Um, as far as equipment and donations go, I'm not gonna lie. I think the beginning of the war, the equipment that I got and the things that I've been getting, especially in medicine, the past few months, were making very big differences. I mean, for I'll just give a simple example. For me, I'm 159 in centimeters. I don't know how to translate that to inches, but I'm very short. And for me, when I got the regular IDF equipment, it didn't fit me, and it didn't fit any of my female paramedics. And we had donors who reached out to us and gave us bags that were suited and tailored for medical equipment, and they fit us, and they even redid them for us when we said, okay, this should be different, or the back system is like that. And we got donations to the whole Givati Brigade, and it's allowed me to walk miles with my equipment, and it's allowed me to take care of patients much better. And even with that IO technology I was talking about, the putting nails in people's bones, we got different devices donated by different organizations, and it's allowed us to do our job better. I don't think the IDF doesn't give good equipment, and nothing is missing. I would like to clarify that. In the beginning, there was a big, mess because so many people drafted. We didn't have enough for everyone. But now I can say that the general equipment that the IDF gives is good for the general soldier. Sometimes we have populations that need certain things, so the support with medical equipment or with protective equipment that sometimes we don't get is important. And um, that's it. We don't really have anything that's, crazy necessary right now, but we appreciate the don and we feel the desire to help.
Indeed, there could be a lot more questions, and I'll just tell you that throughout this conversation, I've been receiving so many text messages, chat messages that you were absolutely incredible. You're an incredible human being. You're, you're an incredible commander, soldier, officer, physician, and I know you, so I know that all of this is true. And we're just all of us are from wherever we are in the world are sending you and your platoons and your brigade and the whole IDF, wishes of health and safety for all of you. And I just wanted to say that I think that, I've been hosting a lot of these webinars, but to hear you speak with your honesty, straight from your heart, all these things is just has been a incredible experience for me and for the other attendees. And I just wanted to thank you for all that you're doing and sending you a lot of hugs and love here from the United States. And is there anything last thing that you want to say before we close this session?
Just to say thank you for having me and wish you luck with all that you are struggling. And I know that it's not easy to feel the way you're feeling and to feel unsafe or that you're being targeted. But if you know in your heart, and I think you should know in your heart that you're on the right side and that you can be proud and you can keep your head up and know that you always have your, if people call it our eternal home. I think it is. And we do what we need to do to protect it. And it's a certain time in history that's, I think, hard for us as a people and as a nation, but I have to believe that it will get better. And so I wish it gets better for everybody. And I wish that the hostages return home safe and fast, and that, this war is over as soon as it can be.
This was actually one of the questions that I wanted to ask you about but next time we'll have to have a second session in your next vacation, which is probably going to be in 6 months. But I wanted to ask you specifically about all the efforts and how do people on the ground feel about the kidnapped and how it is the highest priority. We talked about it a little bit, but this will be for the next session. And just a reminder, because one of the things that you just mentioned was about that it's important for us, based on Kim's question, for every one of us here in the United States, Australia, Europe, etc., Canada, is to fight anti-Semitism and represent us. And with that, just remember that today at 2 p.m. Eastern time, so it's in about an hour and a half, there will be another webinar with Professor Giura, and he's going to speak exactly about this, about the passivity and how important it is that we will all take action and the whole, historical perspective about bystanders and enablers. So it's in the chat for whoever is interested. And again, thank you for everybody who joined. Thank you again, Adi. You're incredible. And please enjoy the next 2 days of vacation that you have before going back to Gaza.
Thank you very much. Thanks for
Be
having
safe.
me. Thank you.
Bye, everybody.
Bye. Have a good Sunday.